What do a person's employment situation, housing quality, and access to health services have in common? There are all factors that influence the health of individuals and populations. Together, they are known as determinants of health, and there are quite a few of them. They are related to the everyday life of individuals and include health behaviors, living environments such as housing quality, and systems, the education and health systems, for example. Factors related to the overall context also need to be considered. The political, economic, and social situations in which a person lives can influence their health. Political decisions about how educational services are organized, for example, can influence access to education. A holistic view of health and well-being has always been shared by Indigenous peoples. Individual behavior and genetic background are not the only factors at play when it comes to health and well-being. For many Indigenous peoples, health is much more than just the absence of disease. The different facets of health include mental, emotional, spiritual, and physical well-being. A multitude of factors influence the various aspects of health. Some of these are more specific to Indigenous peoples because of their worldview or living context. Several approaches can be used to organize and classify the various factors into what are called frameworks, which often include visual representations. An international literature search conducted by Institut National de Santé Publique du Québec identified 15 frameworks used to express the perspectives of Indigenous peoples on health. Here are two examples deemed to be relevant to the Canadian context. They share characteristics with other frameworks analyzed by the Institut. The first framework, published by the National Collaborating Centre for Indigenous Health, is the Integrated Life Course and Social Determinants model of Aboriginal health. The factors are set out in a series of concentric circles, in the middle of which is an important component of population health, the child. The repercussions on children's, young people's, and adults' health of factors related to the overall context, such as colonialism, racism, discrimination, and trauma, are identified. Now let's take a look at the framework of the Nunavik Regional Board of Health and Social Services, which sets out the Inuit view of health and the factors influencing it. Culture and language are at the root of health, represented here by the leaves around the berry. They serve to affirm individual and collective identity, which foster health and well-being. This framework, like many others, emphasizes factors that foster health, which is to say, strengths. Those strengths include a collective dimension, the community and extended family, as well as the importance of an individual's relationship with the land and their Indigenous identity. How are these frameworks helpful? They are useful in identifying all of the factors that influence health over the course of a lifetime, understanding the interactions among factors, targeting levers of action for health promotion and prevention. Interested in incorporating a framework into your practice? Think about the frameworks familiar to and used by your team, partners, and target population. Visit the Institut website to learn more.